Should children wear masks when they go back to school? Should they be worn only in certain contexts, in certain settings? And just how much protection do they offer those who are wearing them and the adults they're interacting with? I'm Annie Demelt for the McGill University Health Center's MUHG-TV. I'm joined by Dr. Christos Karatzios, who is a pediatric infectious disease specialist at the Montreal Children's Hospital. Thank you for joining us.
Thank you for having me.
So let's start by establishing what we know and don't know right now about how COVID-19 affects children and how they transmit the disease.
Most epidemiological studies since the beginning of the pandemic have shown that children are not the main spreaders of this illness, and it's mostly adolescents and older adults. We also understand that asymptomatic or pre-symptomatic people who are about to get sick are fueling the pandemic, because 40 to 50% of the pandemic is spread by these people. So nobody knew this before, right? This is why we're all wearing masks now, and this is why we're all talking about this now. I think that we have to understand that children between the ages of 2 and 12, even though it's not mandatory to wear masks in public, it is highly recommended. And if you, as a parent, if you have a child who is mature enough and calm enough to understand why they're wearing a mask, even though they're under 12, between 2 and 12, sure, they should wear it. It's to protect others. It's to protect themselves. Until the dust settles on how the transmission is known 100%, I think we should all be erring on the side of caution. Of note, children under 2 years of age, it is not recommended to slap on a mask on a baby, because babies, they can suffocate by wearing a mask. I mean, they're in their little, their little poussettes, their little carriages, their little car seats. On top of that, you stick a mask on them, they can suffocate. So this is not recommended. But between 2 years and 12 years of age, strongly recommended if they can carry it. And above 12 years of age, for sure. I think that's a no-brainer.
How do kids who are immunosuppressed, how do they fit into the equation? What should be done with them when it's time to return to school?
Right. So that is a very good question again. And again, it falls down to basic principles. Anybody who's immune suppressed, it doesn't mean COVID or not COVID. Let's talk about the flu season, right? What did we used to do during the flu season? We would tell parents, maintain washing hands, make sure that the child understands to wash hands, to make, if they're sick or if they're feeling unwell, to stay in school, proper cough etiquette and, sneezing etiquette. We tell everybody this, but immune suppressed patients, on top of it, there's a vaccine, right? Vaccinate them against the flu. Vaccinate anybody around them against the flu. Cocoon this person, because they are vulnerable. This is not new for COVID. What is new for COVID is we don't have a vaccine. And, the only way we can prevent infections from happening is from wearing masks and to be socially distant. So again, an immune suppressed child between 2 and 12 years of age, if they can wear a mask, wear a mask. If they cannot wear a mask, they're rambunctious, they don't want to, they're autistic, it's hard, I think that these are the kind of people that others around them have to be super careful, regardless of the fact that, pandemic or not pandemic.
Could you see, for instance, kids, when they're able to be socially distanced, for instance, sitting at their desks, wouldn't need a mask, but then in other contexts, such as going on the school bus or during recess, would then need to put on the mask? Because that would make most sense.
That would make sense. Of course, mask wearing, as I said, the more the merrier, for sure. If all else fails, then social distancing is what is important.
So you mentioned before, it's a no-brainer for teenagers, what they should be doing. What's your advice to parents of teens right now?
Number one, being socially distant with your peers. We are a social animal, and teenagers love to hug, group hugs and lie on top of each other. I've seen kids, on top of each other and, let's share this drink. Do not do that. Don't share drinks. Don't share other things that you're sharing. Wearing masks if they're indoors with their peers. Let's say they go to this coffee shop and they're hanging out at the table. They should be wearing a mask.
So as parents are bombarded with all kinds of information about masks, whether or not to wear them, what do you think that they should be telling their kids? Should they be leading by example right now?
Regardless of what you believe in, be the role model. There is no doctor across the spectrum of believers, non-believers, or whatever. There is nobody that thinks that washing hands, maintaining a distance, and putting on a mask is something that we should not be doing. If a child sees their parent wearing a mask, even the first time, the second time they refuse, eventually they will mimic their parents and they will say, I'll wear my mask too.
Thank you so much. Very good advice, Dr. Karatzios. Thanks again for this.
Thank you. My pleasure.